So, I will talk about oxygen therapy. So, basically, from the name itself, it is implied that oxygen therapy is treatment modality in which we provide supplemental oxygen to our patient, especially if our patient is having difficulty in breathing and having or experiencing hypoxemia and hypercapnia. Okay, it is important, aside from the verbalization of our patient, it is important that we assess our to assess and validate if her complaints. So oxygen therapy can be classified into two delivery system, which is the low flow and the high flow delivery system. Selecting the delivery system uh, can be based on the required oxygen of our patient and the prevention to hyperoxygenation complications. We don't need to, or we don't give too much oxygen to our patient because aside from the complications, we are removing the hypoxemic drive of our patient. So tapos also there are factors that we should bear in mind in choosing the delivery system to use in our patient. One is one is the oxygen required. Second is the underlying or presence of respiratory disease or cardiovascular disease. The age, the environment, the environment, presence of artificial airway, the need for humidity, compliance, or tolerance on during the procedures. So, in order to provide an accurate oxygen, so there are different types of equipment that can be used to during the procedure. So for the low flow system, we can use the nasal cannula, a simple mask, and a face tent. And for the high flow system, we can use a non-rebreather uh, mask and partial rebreather mask and venturi mask. So uh, so again, the purpose in conducting or providing oxygen therapy to our patient is that uh, our aim is to relieve our patient from hypoxemia and hypercapnia. Another is to maintain adequate oxygen level to vital tissues and organs, and as well as to reduce the workload during breathing in order to provide or to improve the quality of life of our patient. Now let's move one of the nursing diagnoses that we can give to our patient, or we can diagnose our patient, is that impaired gas exchange related to ventilation perfusion imbalance. Yes, related to ventilation perfusion imbalance. So one of nursing procedures that we can do to our patient is that, of course, as practiced by our college, is to identify our patient using the two identifiers. Next is to introduce ourselves and introduce the procedure to our patient. So another is we can also conduct a history of the patient's complaint. So whether if the it is important that in the delivery of oxygen therapy is to identify whether the patient is having or have an underlying respiratory disease, so that we can determine the level of oxygen saturation that we can I mean the level of oxygens that we will provide to our patient, so that to prevent complications as well. So aside from obtaining a history of our patient, another is to note if there are any procedures that can interfere the test results. Another is to assess the patient whether if the patient has allergies, especially if the patient has allergies to latex, because you know the band is mostly, or some of the equipments that are being used are comprised of latex materials. So during the procedure, we should instruct our patient to cooperate and follow the guidelines in oxygen therapy, so that the procedure is smooth and ensure that the effectiveness as well of the treatment. So okay, after the procedure, we will report the results to the physician, to the providing healthcare professional, who will discuss ang mga results if there are any abnormalities found, because as we all know, oxygen therapy, prior in giving oxygen therapy, there are tests that can also be conducted to ensure if the patient is having difficulty in breathing, or having or experiencing hypoxemia and hypercapnia, such as using pulse oximeter, the ABG studies. Yes, in ABG studies, there is an increase in partial carbon dioxide, a decrease in both in blood pH and the partial oxygen. So which implies that the patient experiencing pulmonary acidosis. So of course, and another is the record the rate of oxygen that we give to our patient. So that's all.